Hi, this is Dr. Bhargava, and in this short video, I have a few interesting cases to share with you. Our first patient presented with a history of lymphoma. This was a follow-up study, and we will start by looking at the rotating image from their FDG PET-CT scan. The focus that we see in the neck is in the thyroid nodule, and so something like this should be followed up with ultrasound, and if there is a solid nodule, then they should get biopsied because 50% of the times they turn out to be differentiated thyroid cancer. Other 50% of the times they are just benign adenomas. So we see this focus of uptake in a patchy fat pattern in the left lung, and this corresponds to the focus of consolidation seen on the CT scan. So the question is, in this patient with lymphoma, can this be lymphomatous involvement? Yes, it can be lymphomatous involvement. Lymphomas can be seen as pneumonias or a pattern that is suggestive of carcinomatosis in these patients. But remember that most of the times primary lung lymphoma is very uncommon and lungs are involved secondarily. And so what that means is that when there are findings in the lungs or lymphomatous involvement, there would be FDG active disease elsewhere also. And because there is no FDG active avid disease elsewhere, this should be reported as likely pneumonia, which is also very common in these patients. Here's our next patient. We will start by looking at the rotating image. And here we find that compared to the other scans that we have seen, this patient's scan shows excessive soft tissue activity and not as intense brain activity. And actually, these are both related. If you pay attention to this image, there is no excretion from the kidneys into the urinary bladder. And that is the reason why there is persistent soft tissue activity on their scan. On the CT image, we find that the kidneys are holding on to a previously administered intravenous contrast. That's why they are hyperdense, and that tells us that they're not functioning well. And the reason for the kidneys not functioning well is also seen on the scan, which is this collection, which is in the right retroperitoneal space. There's a large hematoma. It's a hematoma because it's hyperdense on the CT, and it shows some layering or different attenuations. And so they were on anticoagulant treatment, and they bled in the retroperitoneal space. Now there is this large hematoma. Their intravascular compartment has contracted, because of which they have developed pre-renal azotemia or acute kidney injury. And so there are things that you can pick up on FDG PET-CT scans that are outside of oncology, and these findings are important to pick up and report. This is our next patient. This is pretty straightforward. They presented for the evaluation of a seizure focus. We performed an FDG PET-CT study of the brain in the interictal state, and we find that there is moderate to severe hypometabolism involving the right temporal lobe compared to the left. And on the CT scan, we find that there are no focal findings in that temporal lobe. And this rotating image is also showing in this right anterior oblique projection that there is normal uptake in the left temporal lobe, but there is decreased uptake or activity in the right temporal lobe, suggesting the presence of seizure focus. Check out my books on the Apple Bookstore and the 2 courses on the website. Thank you for watching.